Bursitis is a condition which, as its name implies, is an inflammation of the bursa. The bursa is a specialized tissue which actually occurs in many different portions of the body. If you can imagine a part of the body where two different levels of tissue, such as skin and bone, have to move across each other, that's an area where we have a natural bursa. The bursa itself is a tissue which is quite similar to a mucus. It's thin and it's very slippery. It occurs in the shoulders, the hips, the elbows, the knees, and so forth, again, where these two levels of tissues interact. When the bursa becomes inflamed, either from repetitive use, injury, and so forth, it becomes a bursitis. In the elbow, there's a special bursa called the olecranon bursa, and that's just a fancy term to mean that the bursa is about the knob on the back of the elbow. That area can become inflamed. We typically see this in individuals who place their elbows on firm surfaces frequently. Now, thankfully, it doesn't occur in every person who does this, otherwise it would be rampant. But it does occur in people who, for some reason or other, seem to be more or less predisposed to developing this condition. In that regard, you may see that a small knot or knob, or some people refer to it as an egg, develops about the back or posterior aspect of the elbow, in the region, again, of that olecranon, where the knob is. When that becomes inflamed, it can become quite painful. And in fact, as the nature of its inflammation, it may become infected. When a person has an infected bursitis, we may consider antibiotics or surgery. But thankfully, most of these bursitis, including the elbow, the knee, and the shoulder, do not become infected. Those can be treated quite frequently with a simple ACE wrap, or perhaps what we call an aspiration, meaning we place a needle within that bursa and remove the fluid. Lastly, we may consider placing a corticosteroid injection to reduce the inflammation. That typically does the trick for most instances of bursitis, and it makes the symptoms resolve completely. For those really stubborn cases, however, we do have the option of surgery. And I'm thankful to say that very infrequently do these conditions require surgical intervention. But God forbid we should get to that point, it is a tool that we have in the toolbox.